Inspire is a device that's implanted in the body to help patients with obstructive sleep apnea. It's very similar in concept to a pacemaker device. My goal for my patients is to get the relief that they're looking for. Most patients come to me to discuss this device because they have sleep apnea. They're miserable from their sleep apnea. Some are just tired. Others have headaches. Others have poor concentration or depression. Others just want to not snore anymore because it's bothering their spouse. The real beauty of solving or resolving sleep apnea for a patient is that I'm eliminating the potential for diseases that could really have a harmful effect on them down the road, such as heart attacks, strokes, cancers, diabetes, obesity, things like that. And so not only do I get to relieve symptomatic suffering, I also get to help prevent worse disease from developing. Tell me a little bit about how you're feeling with your sleep apnea when you're not wearing that CPAP.
I feel exhausted, tired, totally fatigued out, as if I'm having jet lag. Sometimes I have headaches too.
Yeah, pretty classic for sleep apnea. Based on what I've read on your sleep study and what my nurses told me, you're actually a really good candidate to consider the Inspire device. This is a dummy device. It's not an actual one, but it's the same size and shape. Go ahead and feel it and take a hold of it so you get an idea. Basically, it looks just like a pacemaker. In fact, the technology is very similar to a pacemaker device. What we do is we implant this device in your chest, about 3 finger breadths below your collarbone. So collarbone's right here, about 3 finger breadths below that, and it sits right here in your chest, underneath the skin, right on top of the pec muscle. And you can notice in this device, there's 2 what we call leads. Each of those leads has a very specific purpose. One lead actually goes down and is implanted in the muscle of your rib cage, and that lead is called the sensing lead. The sensing lead has one job, and that is to detect when you take a breath. A second lead, that's what we call the stimulating lead. That lead goes up under your skin to the nerve of your tongue. So overall, the surgery only takes about an hour to implant. It's an outpatient surgery. You go home on the same day. And generally, people don't use very much pain medicine at all, which is the wonderful part. There's an incision on your chin. We always implant it on the right side. It's right here, just underneath the jawline. The beauty of having it there is because of the shadows of your jawline, it actually hides very well. There's another incision right here where the main implant goes. So we make a small incision, a little pocket, and then slide this in, and it will sit there. We won't need to make this lower incision anymore. We're going to be one of the first practices in the country that's going to be regularly performing that, which is kind of nice. Saves you one less incision, one less scar, faster operating time.
Sounds good.
Excellent. Do you have any questions about the procedure?
No, I don't. I'm looking forward to it, actually.
We bring you up to the front so you can get checked out, and we'll see you soon.
Yes, sir. Thank you.
Thank you. I have always tried to be on the cutting edge of medicine because I'm such a technology nerd. I always try to look for new and innovative ways to help patients. And when this device first appeared on the market, it looked so promising that I immediately contacted the company and said, I want to be a part of this procedure if it truly does help patients. It was really rewarding to see that first patient. He was actually featured on the news discussing how much better his life had improved by having the Inspire device.